good morning. I'm Marko Vujicic. I think I heard the tail end of my intro. We'll dispense with that. I'm a health economist, and I head up a group called the Health Policy Institute, which is kind of a arm's length think tank within the ADA. I have the privilege to lead a team of 15 PhD economists, PhD psychologists, PhD health services researchers, statisticians, you name it. And what we do is we look at data, a lot of data, and compile this in ways that are useful for decision making, policy making. And so what I want to do today is just give you a few snapshots of Pennsylvania specific research and data that we've done. I'm going to show you at the end our webpage. We have put together a ton of state-specific fact sheets on different aspects of the oral health care system. What's on the screen now are specific data for Pennsylvania. This is a very large survey of adults that we did nationwide with state-level representatives. And what I've pulled out is just one question we asked adults is, why don't you visit the dentist more often if you had not had a visit before? And as you can see here on the top panel, cost by far is the #1 reason people don't go to the dentist. And then you see the cascade of the different ones. If you look on the bottom, we split this out by low-income adults, middle-income adults, and high-income adults, and you can see where those reasons line up there. Trouble finding a dentist is generally not in the top reasons. When you do go to low-income adults, it starts to pop out as reason #3. But kind of the big picture takeaway from this research and many other strands of research is that financial barriers seem to be the most salient issue when people are avoiding dental care. Now we're switching to children on Medicaid. I'm going to give you a couple specific charts and maps, and that'll be it for today. What we've done here is we are able to measure the number of dentists who participate in Medicaid for child dental services. Going along the x-axis. So basically, as you go from left to right, you have more and more providers participating in Medicaid. And as you go bottom to top, you have more and more children accessing dental care in Medicaid. Now, when we drew this, we were expecting to see a nice smooth line going up from the bottom left to the top right. And obviously you don't see that. And the reason I flagged here this chart for you is these data suggest to me that Pennsylvania is kind of underperforming in terms of the number of Medicaid providers it has. There are many, many other states that have similar dental care utilization rates with far fewer Medicaid providers. Again, the storyline suggesting to me here is that, well, it's not that you have a lack of providers. You actually have one of the higher rates of Medicaid participation relative to the stock of Medicaid children, but utilization is really low and is below average, so something else is going on there. And so I'll just end with a couple maps. This is new. I've worked with several oral health coalitions at the state level like yours. This is something they're asking for more and more. What we do here is we are able to map every location where you can get dental care in Pennsylvania. This includes private dental offices and FQHCs, dental schools that have clinics, etc. And we're able to code those that accept Medicaid patients and those that do not. Those are the dots you're seeing, color-coded. And then in the colors are patches of Pennsylvania where we're measuring the number of poor children. So basically red is a high poverty area, dark green is a low poverty area. And why are we doing this? Well, we then do some very sophisticated geomath. We overlay all the road networks in Pennsylvania. And what we do here is we construct 15-minute travel times. So what you're seeing here in what looks like cloud cover over Pennsylvania is the coverage area that is within a 15-minute travel time to a Medicaid accepting dental location. And as you can see here, there's spots that aren't covered, like that red one in the middle, which is a high poverty area without any coverage of dentists. But what this allows us to do with some fancy Geo Analytics is to come up with some basic statistics, number one. So I can tell you that 94% of Medicaid children in Pennsylvania live within 15 minutes of a Medicaid participating dentist. Within those 95, about 92% are in areas that have quote unquote adequate supply. But more importantly, if you're a policymaker and you look at this map, you can basically see where your kind of hot spots of lack of coverage are. And like I said, only about 6% of Medicaid kids live in areas either that are not within a 15-minute travel time to a Medicaid dentist, or are within a 15-minute travel time, but they're just too few dentists relative to the number of Medicaid children. So I'll end there. All of this stuff, except these maps, which we're just starting to publish, is available at this website. I'd encourage you to go ahead and look at those data as they are designed specifically for folks like you.